My name is Greg Dewey. I'm the president of Albany College of Pharmacy and Health Sciences, and I want to welcome you to this segment of Dialogues with Dewey. Today we're going to be talking about student-operated pharmacies. The Albany College of Pharmacy and Health Sciences recently opened a student-operated pharmacy in Schenectady, New York. It's located at the Hometown Health Center in State Street. This is a unique opportunity for students to get hands-on experience, not only running a pharmacy, but working in an underserved area of our region. I'm here with Lois Aller, who is one of the first students that has worked in the pharmacy, and I wanted to talk with you about your experiences there. So tell me about, you were there at one of the first days of the pharmacy. Tell me a little bit about what that was like as a student coming into that setting.
Well, as a student coming in, I didn't know what to expect. I'd never worked in a pharmacy that was located inside of a clinic, so it was a unique experience. I'd also never worked in an underserved community, such as the one that was in downtown Schenectady. So I was able to have that experience and grow with that. Did
you find that an attractive setting? You volunteered to work in those early days, and that idea of working in a clinic in an underserved area, you found that to be an attractive thing to do?
Absolutely. I thought it was a unique experience because being in a clinic, I got to see some more collaborative care. We're in the same setting as the doctors and nurses who are prescribing the medications that are being sent over to the pharmacy. So if we need to clarify a script or see what's going on with the dose or something like that, we could just walk right over across the hall to the doctor's office and we could see more collaborative care going on.
Now, do you see working in a setting like that with that population, this predominantly a Medicaid population, a lot of low-income families, what do you have to bring to the table that's different than maybe a normal community pharmacy setting?
Well, you get to see, working with the underserved community that's very low income, you see a lot of different issues. You see a lot of people that don't necessarily have the education or the access to primary care. If they're all Medicaid patients, so a lot of them aren't seeing as much preventative care. So you need to come to the table prepared to do a little bit more in terms of counseling and also a little bit more in terms of referring them to the primary care specialist that would need.
You know, Louis, there is, as you're well aware, there is a primary care crisis in this country, right, and in New York State. Many people, especially Medicaid people, don't have primary care. And, you know, we are in an era where the pharmacist has to step forward and fill some of that void. How do you see that working out in Hometown Health with the collaborative possibilities with the clinic there?
I really think the possibilities are endless. Like, as you said, there is a shortage of primary care physicians, especially in low-income communities. So we as pharmacists would have the ability to help do more triage, help refer to people who are not receiving primary care to more screenings for diabetes, for cancer, for blood pressure and cholesterol, etc. And we could help in that way.
So you've only had a brief experience there. How do you see this impacting what you're going to do in the future?
Well, I've definitely learned a lot through the experience, and also have grown, and I think I've become a bit more compassionate too, working with the people there, and gotten to see a different side of healthcare and a bit more primary care through working at the clinic as well. So I think it's increased my knowledge base, and also just it's been great for my professional development.
What type of pharmacy would you like to go into after you graduate?
After I graduate, I would like to own my own independent pharmacy, which is my goal, and I think that the experience I've had there at Hometown Health was also helpful because I got to see the soft opening and what went into dealing with contracts with insurance companies and starting off a pharmacy.
Well, thank you, Lois, for joining me today. This has been Dialogues with Dewey, and I hope you found this segment informative. and I will see you next time.